Falls are a major health concern among the elderly population. Every year, nearly 1 out of 3 of those aged 65 and older experiences a fall. Falls are a leading cause of both fatal and non-fatal injuries in the population. In 2010, 2.3 million fall injuries were treated in the emergency room, and over 21,000 seniors died from fall-related injuries. One of the most common complications of falls is hip fractures. This leads to a loss of independent functioning, and many patients require lifelong nursing care. These patients may suffer from other broken bones, physiological trauma, and other long-term health consequences such as another fall. So how can falls impact your life? Well, falls can decrease your quality of life, making it hard for you to cook, move around the house, or even take in the shower. That's why it's very important to listen to these preventive measures that we're going to talk to you about today. It can also help you prevent a fall or even minimize your risk of falling.
Hi, my name is Lacey, and I'd like to go over a few things that can help prevent falls around the house. First things first, the best thing that you can do to ensure that you are avoiding any areas around the house that can cause falls is to have adequate lighting. So to do so, we're going to turn on the lights today. Much better. The next thing that you want to do is to take a look around your house and find any areas that you would identify as high traffic areas. This is any area that you frequently walk through, such as hallways, around furniture, paths that you would take to get to the kitchen or the restroom. These are areas that we call high traffic areas. And in these areas, we want to make sure there is no clutter on the floor or anything that can cause you to trip in these areas, such as cords. Appliances with long cords can be bound up with straps to remove the cord from walking space. If you do not have straps to do this, you can simply tuck wires behind furniture to move them out of the way. With that done, the next thing I want to bring your attention to is loose rugs, such as this here. Loose rugs often can pull up in the center, which can lead to tripping as you're walking over it. To get rid of this problem, always make sure that you get the rug grips that can attach to the corners of the rugs and firmly secure them to the floor. Once you have all rugs in place, next step is to look for objects that you can bump into, such as smaller pieces of furniture that you wouldn't normally think of as a fall risk. For example, having tables or any piece of furniture through your high traffic areas at the knee level or below are commonly used as falls because when walking quickly through these high traffic areas, it's easy to trip over such items. So again, when you're trying to improve your house and reducing fall risks, just look around, look at anything that might come loose or cause a trip, or areas that need more light. Once you get these things done, you're on the right path.
Hello everyone, I'll talk to you all about the risk of falls that can happen when using a shower. The Consumer Product Safety Commission indicated that many as 70 people over the age of 65 die from bathtub-related injuries. Using a shower is a situational factor that increases the risk of falls. In the US, falls are the leading cause of accidental deaths and the 7th leading cause of death in people greater than 65 years of age. A normal bathtub can look very nice to us, but for an elderly, the height of the tub, the slippery surface, and with no handrails can be an easy place to fall. Some of the measures that could be implemented to reduce the risk of falls are to have handrails in the shower. We could also have rubber mats and low shower floor so that it is easy for them to get in and out without slipping.
When approaching stairs, check to see if there are handrails available. If not, then the stairs should be avoided. It is important that when in this situation, you look for another stairs that has an handrail. It would be even better if you found a ramp.
This is so much better.
Even when going for a relaxing walk, you may still encounter obstacles, such as mounds or cracks. Even smaller cracks can cause you to trip, so remember to be vigilant.
Many medications can actually increase the risk of falls. They do this by reducing alertness, affecting balance, or causing dizziness. Pharmacists have the potential to make a big difference. They can educate both the patients and the caregivers of potential adverse effects and precautions of their medications. They can inform the patient on how to deal with and minimize side effects. They can monitor the patient's drug file and look for medication-related problems as well as inappropriate medications. If there is an issue in the medication profile, they can recommend changes to optimize therapy.
Hi, my name is Suzanne Huber, and I'm going to talk to you about the top 10 ways to prevent falls in the elderly. Some of them may have already been covered, but I want to go ahead and emphasize the ones that are most common. So, ways to avoid falls in the elderly. 1 is to make sure that you go to your regular scheduled doctor's appointments. 2, keep moving. Make sure that you exercise. This keeps your bones strong and keeps you more mobile and helps with balance. 3, wear proper footwear and shoes. This will help to prevent the risk of falls as well as tripping over your own feet. And 4, have proper lighting within the home. Dim lights can increase the risks of falls by not seeing objects that may be on the floor. 5, you want to make sure you remove the clutter as well as hazards from the home. So if there are rugs that can be moved, or if there are different papers or toys or decorative items, you want to make sure you remove those from the home as well. Number 6, you want to decrease the risk of falls within the bathroom. So this means make sure that you have proper seating within the shower, if you need a shower seat, if you need grab bars, as well as a handheld shower will help to decrease the risk of falls. Number 7, look out for potential drug interactions. There are a lot of drug interactions that can actually increase your risks of falls, which cause drowsiness, lightheadedness, and even sedation, which is being sleepy. Number 8, you want to make sure that you use assistive devices properly. Walkers, canes, if you have those, even wheelchairs, if you have those, make sure that you're using them properly. Number 9, don't be scared to ask for help. If there's something that you need help with, or if you need someone to open a door or help you carry things, don't be scared to ask for help. And number 10, be proactive. Always make sure that you are aware of different things that can increase your risk of falls. Thank you very much.